We appreciate your trust in us and all the care you've put in thus far in your own recovery. At this point, you're about 2 weeks out from your procedure and at the stage where some of the previous restrictions will begin to lift. You may feel ready to resume some of your normal daily activities and get back to your life. This is an exciting time, but still a time to take it easy and remember, you are still in recovery. There are a couple of things that we'd like to remind you of at this stage and pointers you can use to accelerate your recovery and maximize your results. I'm going to hand it over to our post-op team for more information.
Now that you are 2 weeks from your rhinoplasty surgery, you should be beginning to feel much better. You should be feeling your energy returning at this point and be fully independent with your post-op and incision care. This is a turning point in your recovery, so we wanted to check in with some further instruction to help you feel your best at this stage. You should be completely off stronger pain medications at this point, but you may continue to take Tylenol or ibuprofen as needed. Depending on your care plan, you may also still be using gabapentin or muscle relaxers, but should be weaning off at this point. Your bruising and swelling should also be starting to improve. Continue to monitor your incisions and surgical site for any signs of infection, fluid collection, or openings in the incision. Your skin glue from surgery should be at or near the point of dissolving, and if you do notice an opening, clean the incision with peroxide, cover it with an ointment, and keep gauze over it. Call our office to discuss any further steps. Remember, your sutures are dissolvable and should not need to be removed. However, you may experience what is known as spitting sutures. A spitting suture is a dissolvable suture under your skin that is rejected by your body before it can completely dissolve. These spitting sutures can cause swelling, redness, and/or oozing at the incision. This is normal and will likely go away on its own, but call our office to discuss with our providers. At the 2-week mark, many of your restrictions are lifted. You are likely beginning to return to normal daily activities, normal lifting, house chores, easy activities like walking, standing upright, and lying flat when resting. Still, no strenuous activity or exercise should be done until you get clearance at your next visit. If you are returning to work or have already returned to work, remember, no heavy lifting greater than 35 pounds. You should be taping your nose at night for the next 4 to 6 weeks. You should also avoid wearing glasses or blowing your nose for another 2 weeks. Remember, it takes nearly a year to see your full result from rhinoplasty, so don't be discouraged by any swelling you see. Good things take time to develop. Patience and adherence to these instructions will be well worth it. If you have any questions or concerns at this point, please call our office. We will see you soon.